All right, so we're going to set up the surgery table for the castration procedure that we're doing today. It is really important to make sure that we maintain the most aseptic environment possible in the surgical theatre. So absolutely no towels or anything that's going to leave lint behind in the surgery theatre. So today we're going to pad our cold stainless steel table with bubble wrap, which has been pre-disinfected with some chlorhex and alcohol. So the idea is we want as little of the cold as possible to come through to the patient. So we'll do a couple of layers with bubble wrap. And we are doing surgery on a 40-kilo dog today, so we do need to make sure we cover the whole table as much as possible. The surgeon has requested a V-trough for the surgical procedure today. So that works really well for us because we're going to use a cocoon warming system, and the V-trough actually sits quite nicely over the top of the cocoon. So this is a surgery under blanket for medium and large dogs, and what this will do once it's inflated is it will provide heating all the way around the animal. Just open this up. So before I do start inflating it, I'm going to place the V-trough over the top of the table first, because that will help to hold the weight down and stop the warm air blanket from sliding off the table. All right, so long dogs, I'm going to use a couple of V-troughs. Now my cocoon is already plugged in. See that one there? Simply take the hose and break open this tab. Push the hose through the open hole there. Tie that up. Then when I turn this on, so what we have is warm air circulating around the patient. So if you can imagine that our patient will be laying here, obviously head towards the anaesthetic machine. We're going to be circulating this warm air around our patient. We start the cocoon on 46 degrees. After about 20 minutes, it'll drop down to 38. So what we want to do is obviously make sure that we counteract all those medications that we give them before the surgical procedure, which will cause blood pressure and temperature drops. So hopefully, if we start active warming at the start of the procedure, we can avoid some of those temperature drops during the procedure.